Welcome to Thursday Thought Leaders with Harbinder Narula on BW Healthcare World. My guest today is Dr. Anil D'Cruz, who is a known figure in the field of oncology, serving as the Director of Oncology at the Apollo Cancer Center. Now, with the experience and the expertise, Dr. D'Cruz has dedicated his career to advancing cancer research and treatment. Dr. D'Cruz offers an invaluable insights into the complexities of cancer disease, shedding light on the causes, risk factors, symptoms, and cutting-edge treatment modalities. Welcome, Dr. D'Cruz, to BW Healthcare World. My first question to you, Dr. D'Cruz, is we've been trying to understand what causes cancer, and there are various theories that are there. So what, in your opinion, is the root cause of cancer, and how do genetic, environmental, and lifestyle factors may be contributing to the development of cancer in a human body?
Excellent question, Harbinder. Let me quickly answer this. It's a long answer, lengthy answer, but I'll try to be as brief as possible and as precise as possible. Basically, cancer is a lifestyle disease. As you get older, your cells are more prone to wear and tear, and you get cancer. Now, along with getting older, if you have certain environmental factors, and there are plenty of them, but I'll just highlight three very, very quick or most important factors. One is habits, tobacco and alcohol. Tobacco causes close to 40% of all cancers, anywhere between 25 to 40%, depending on the place you are in. In our country, it's close to 40%. So the first is habits. The second is infections. You have hepatitis, you have HIV, you have human papilloma virus, HPV, that causes cancer of the cervix in women. Cervix is the mouth of the womb or the mouth of the uterus. These are infectious cancers. These cause about 10 to 15% of cancers. And the third is obesity. People who are heavier for their age and their height have an increased incidence of getting cancer. I'll just, kind of make this a little more relevant by quoting, when we got independence, the average lifespan of an Indian was 47 to 50 years. Today, we live till about 70 years, the average lifespan. Our middle class is growing. We've started aping habits of the West, these alcohol, tobacco, the obesity business, eating unhealthy foods, getting various types of infections because of our lifestyle. And that's why you see a rise in the incidence of cancers. Look at it between our urban and our rural. So the incidence of cancers in our rural population is approximately half of what we see in the urban population. So driving a very important point home that cancer is environmentally driven in a vast majority of patients. About 10 to 15% of our cancers could be genetic. Breast cancers can run in the family. You have two first-degree relatives with breast cancer, the lady is more prone to breast cancer. Colorectal cancers, colon, large intestine, and runs in families. There are certain syndromic cancers. I'm a head and neck surgeon. Medullary thyroid cancer runs in family. If you have a medullary which is germline mutated, that means a genetic medullary, 50% penetration into the offspring. Retinoblastoma, tumor of the eyes, runs in family. So they are genetic, and then they are this large group of environmental, and the other environmental factors that can also cause these cancers. industrial pollutions, those that work in asbestos industries, people who have prior exposure to radiation therapy, either knowingly or unknowingly, all of these are factors that cause cancer.
Dr. D'Cruz, I mean, when you talk about radiation, very interesting. A lot of people are talking of that, we are getting more prone to cancers today because we are using microwave ovens. Is that a reality or is it just a myth?
No, no, not really. When I say radiation, I mean ionizing radiation. So there are various forms of ionizing radiation. I'll just give again very simple examples. Sometimes there is background radiation. Soil contains certain, radioactive substances like thorium, things like that. It penetrates into the groundwater. People in these kind of areas are prone to radiation. Then you have radiation that can be because, say, of a nuclear fallout or a leak within, say, a complex that does radiation. For example, if you see the Hiroshima Nagasaki bomb fallout or the Chernobyl nuclear fallout, the nuclear thing goes around and people who are prone in that area get it. And the third form of radiation is people who work in radiation hazardous environments. And a classical example is doctors, technicians who work in CT scan units, in radiology units. That's why they have a little badge hanging on their pocket. And that goes to our AERB, which is our Atomic Energy Regulatory Board, and they scan it. If you get more than a certain amount of radiation, you're forced to take time off. Microwave per se is not harmful, but I tell people that please do not stand in front of the microwave. I mean, once in a way, it's okay. Put your stuff in and you can kind of move away from it. The same thing came with the cell phones at one time. They said if you use cell phones, you have a higher incidence of brain tumors and acoustic neuromas because of radiation. That's really not been proven in large epidemiological studies. So again, my advice to people is don't take a chance. You don't have to hold that phone right next to your ear 24/7. You can, use it less, sometimes put it on speaker, but there's no proven causative effect of using cell phones or the microwave.
Right. And Dr. D'Cruz, can you, for a layman, explain how the cancer cells evade the body's natural defense mechanism and proliferate, leading to formation of tumors? We know that the body has an immune system, but obviously these are evading the immune system.
So it's very simple. Our body does have an immune system. If your immune system is healthy, you stay healthy. Be it cancer, be it colds, cough, be it picking up any sort of infection. So the bottom line to all your listeners, all your viewers is stay healthy. Have a healthy lifestyle. That's very, very important. Now it's very simple. If there's a cell, when the cell multiplies, it becomes into 2 cells, it becomes into 4 cells, it becomes into 8 cells, into 16, 32, so on and so forth. But these cells are regulated by growth. So when you're a young child and you're small, when you grow, there is a regulation. You only grow up to a certain, you don't keep growing all your life till you're 100 and become 100 feet tall. It's regulated growth of cells. In cancer, this regulation is lost. So putting it simply, our body's cells are made out of genetic material. Within the genetic material, the most common thing that your viewers would relate to is called the DNA. When the DNA changes, then these cells get out of the regulatory mechanism. They become abnormal and they start proliferating. And this proliferation is uncontrolled. Again, to give you an example, it's like when you build a wall, you put a wall, the bricks are all symmetrical in the wall. The moment you start developing cracks in that wall, those are pre-malignant lesions. And then that whole wall crumbles into a big mountain, and that's your cancer for you. It's uncontrolled.
Thank you so much for explaining this so beautifully. Dr. D'Cruz, since we're talking about the cause, what causes cancer, we also understand now that how the cells are responding to what is happening inside your body. And you said that lifestyle has to be monitored. What would that mean as a preventive measure to prevent cancer?
So very, very simply, it will be a slight repetition of what I've said. Stay away from tobacco. Tobacco in any quantity and any form is carcinogenic. In our country, I make a point, it's not only tobacco, it's also the supari or the areca nut. Many people walk into my clinic and tell me कि हमने तंबाकू कभी नहीं ली. I'm only eating the supari. Remember that the areca nut is classified as a class 1 carcinogen by the IARC, which is the International Agency of Research on Cancer. So even having these plain supari, so stay away from tobacco and supari. Absolutely. No quantity, no form is permitted. Smoking, chewed, inhalation, applying to the gums, all no. WHO now says stay away from alcohol as well. But the regulation, if you see the WHO recommendation, it is saying minimal or controlled alcohol. You can't sit with a bottle every day and drink away, but the recommendation is no alcohol. Eat healthy. People who eat a healthy diet have lesser incidence of cancer. It's called a chemo-preventive diet. What do you mean by a chemo-preventive diet? A diet which is rich in vitamin A, C, and E. I call it the ACE vitamins. Like in cards, you have ACE. The ACE is the strongest card in the pack. So remember ACE, you have to have a healthy diet. Where do you get it from? You get it from the brighter the fruits and the brighter the veggies, the more of vitamin A, C, and E that you get. Exercise. Keep within your weight. Very strong preventive factors for any kind of non-communicable disease, which includes cancer, as well as heart, as well as diabetes, as well as hypertension. So have this. Stay away from all trans fats, junk foods, say crisps that have too much of salt. That's not a healthy lifestyle. So go back to the days of your grandfathers or think about the medieval time. I won't say medieval time, maybe 50 years back, how people lived. They got up early morning, maintained a healthy lifestyle, kept themselves clean, ate good food. My advice to everybody is eat whatever you want, but eat it as close to how God or nature made it. You want to eat potatoes? Eat, but don't deep fry your potatoes. You can stew it. You can bake it. You can eat it. So people say, no, I don't want to eat. Yes, they have calories, but within your what's for your height, weight, and exercise, please go ahead and eat any kind of food. So quickly stay away from bad habits. Exercise regularly. Keep your weight in check and a healthy diet. And stay away from other harmful areas. Like if you're working in an industry that has asbestos, take proper precautions, so on and so forth.
Dr. D'Cruz, one of the most common treatment terminologies that for a layman, when they hear, when it comes to cancer is chemotherapy. And the first thing that people ask for when they are recommended chemotherapy is that इसके side effect क्या है? And the common ones, of course, people know that, you have a hair loss. But what are these other common short-term side effects of chemotherapy? What could be the long-term complications? And while you're explaining this, one of the confusion that people have is chemotherapy a common treatment across all cancer patients, or who should not be subjected to chemotherapy?
So
If you can
quickly,
explain.
again, very, very lengthy question and a lengthy answer, but I'm going to again make it very simple. Basically, cancers are of two types: solid tumors and liquid tumors. Liquid is leukemias and lymphomas that involve the hemopoietic system, blood and lymph glands. In liquid tumors, chemotherapy is the mainstay of treatment. You take your chemotherapy, chemotherapy alone can be curative in these cancers. The chemotherapies are various types. It could be conventional chemotherapy that kills cells. It could be targeted chemotherapy. It could be immunotherapy. It's all a generic, large comes under the chemotherapy. Now, in solid tumors, that is, what is solid? Mouth cancer, tongue cancer, lung cancer, pancreas cancer, liver cancer, name the organ, that's solid tumors. In those, curative is usually surgery and radiotherapy. Chemotherapy will not cure those cancers by itself. It's given in two occasions in these cancers, or actually three occasions in these cancers. One prior to surgery or radiotherapy to shrink the tumor, make it more amenable. It's given along with radiotherapy when it's a radiosensitizer, or it's given after chemo, after surgery or radiotherapy in a high risk patient. Say you operate a lady with a breast cancer, you gave her radiotherapy. Now we see the reports. The reports say that she's got many nodes positive. It's not hormone responsive. To decrease the cancer coming back, it's given after treatment. It's called adjuvant. So it's called neoadjuvant when it's given before definitive surgery or radiotherapy. It's called concurrent when it's given with surgery or radiotherapy, usually with radiotherapy, and it's called adjuvant when it's given after. Now, very quickly again, chemotherapy acts on all multiplying cells of your body. What multiplies? Your hair. You see, it grows, so it dies. Okay, this is chemotherapy goes all of your body. It goes to your gut lining. So you get sores in your mouth. You might have difficulty in swallowing. Sometimes you get very severe diarrhea and infections like that. It goes to your blood, the bone marrow. So your counts drop. You're susceptible to infections. It's multiplying. It goes to the gonads. So a young boy or girl can get temporary amenorrhea. That means the girl's periods might stop, or the boy's sperm count might go. And it also hits the cancer, which is multiplying. So all multiplying cells get hit by that. Now, research has tried to overcome these side effects in two ways. One, when we give chemotherapy conventional, you're getting hair loss, they give some cooling caps. You're getting vomiting, loose motions, we give antiemetics that now decrease the side effects. Toxic chemicals go through your veins and cause disturbances. We put the line in a bigger vein so that you get lesser side effects. Or research now doesn't, we've advanced from conventional chemotherapy that hits the DNA of all multiplying cells to more specific drugs, which are called targeted therapies. Say in breast cancer, you have a target called HER2. If your breast uh, cancer expresses that, they'll give a drug called trastuzumab that hits only HER2 cells. Then there's something called EGFR. If your cancer in the lung has EGFR mutations, we'll give a drug that only hits EGFR. Baki side effects become less. So in brief, this is how we overcome the side effects. So if your doctor recommends chemotherapy, it's usually given to help have better outcomes.
Right.
Sometimes we give chemotherapy at end stage disease. It doesn't cure, but it alleviates symptoms. It makes your quality of life better, and that's called palliative chemotherapy. So we give chemotherapy in that setting. We tell the patient, the family members, jad se nasht nahi hogi. It will not get cured, but it may not progress that rapidly, and you will have a better quality of life.
Right. And Dr. D'Cruz, one of the confusions that I've seen cancer patients have, who should they go to? Because the first impression that they have been told of, which gets created in their mind, is that if they go to a surgeon, he will tell you that you need to go through surgery first and then chemo. And if you go to a physician, he'll tell you that पहले chemo कर लो, फिर surgery की जरूरत नहीं है. So, is there a way for a cancer patient and their family to consciously, intelligently make what is the suggested, whatever is suggested, what should be their chosen treatment option?
Harbinder, I think this will be the most important question of your entire interview with me. And I'll tell you why. 35 to 40% of work I do is redo work. That means someone has taken the first bite of the cherry, or to pardon my French, someone has screwed up a case and then comes up to me. And the reason is very, very clear. The person who treated the patient had the bias, like surgery karao, do medical treatment, but they should go to the right person. Now, how do you decide who is the right person? Many people get swayed. I'm going to hospital X, Y, it's very good. Harbinder ke mama gaye the, bahut badhiya hospital. Don't do that. All hospitals more or less have the same background. They have the same equipment. It's the man behind the machine, and it's the process. So here, how do you know? How does a lay person know where to go? Follow two simple advices. One, go to a specialist. Cancer is specialized. I'm a general surgical oncologist by training. I can do breast, I can do rectum, I can do head and neck, I can do lung. I'm trained, I'm qualified, but I only do head and neck. So now, please don't go to general oncologists. Those days are gone. It's changing. Abroad, you have site specialization, and there's enough literature to show that those that site specialize have better outcomes. And this is data published in the US from insurance records of over 1 lakh patients. If in US, where the general quality of hospitals is far better than many of our district and other hospitals have that data, it's more compelling in our country. The second is the process. When you go to a hospital, which usually has site specialization, they have multidisciplinary tumor boards. That means a surgeon sits, a radonc sits, a medical man sits, sometimes an X-ray radiologist with the pathologist. They discuss, and then they choose the right treatment for your patient. So insist on multidisciplinary care. And many small hospitals don't have multidisciplinary care. In that case, go take a second opinion before you jump in anywhere for major treatment. It's an important disease. You lose the first chance, your survival drops. One of the things, so I was at Tata Memorial Hospital where we did this. We had site specialization for the last 20, 30 years. All of us chose one part, and it's very obvious that the outcomes and things like that are much better from that kind of an apex institution. But when I transitioned and moved to Apollo, the change I did or I'm trying to do is to bring in site specialization. It's difficult because there are already people within the system. But yes, we are slowly getting there, at least at the Bombay hospital where I practice of Apollo, we've instituted that. We are slowly bringing it into the Delhi hospital as well. And we have the plan to do it across our 25 cancer centers.
Lovely. It is, very beautifully explained. I think it will be very, very useful for anybody who's dealing with cancer or the family of the one being supported. Dr. D'Cruz, you spoke about food and nutrition, and you spoke about ACE, vitamin A, C, and E. And the brighter the fruit, it's more likely to have these vitamins in it. Does the food nutrition change for someone who survived cancer as a survivor? Does this remain true for them as well? Or is there a certain diet that they must follow or at least avoid?
No, the chemo preventive. So I'll tell you quickly what diet they should take and what they should avoid. And I'm going to elucidate this with two examples. If a lady has a breast cancer, why did the breast cancer come in one part of the breast when she's got two breasts? And if you divide the breast into 4 quadrants, 8 quadrants, why did it come? So whatever carcinogen or whatever factor she had should have affected both the breasts. Now, these kind of people get what is known as a second cancer when you cure. Exactly the same in my specialty. Someone who takes tobacco, when they start smoking, the effect starts from the lip, it goes all the way down to the lungs. So if they get a cancer in the mouth, we cure them. 1% every year gets a second cancer. They can get a cancer at the back of the throat later. Correct? So you're prone to second cancer. Now, research has shown that people who stop their habit, ladies who lose weight and stay within weight, have lesser incidence of second cancer. So the first message is eat healthy and stay within your weight zone. You won't get that second cancer. Recurrences are less. The second is people with, say, tobacco-induced cancers. How do you prevent it? Those that have a chemo preventive diet have a lower incidence of second primary cancers. So it's vitamin A, C, and E. So researchers ran and they started doing, and people started popping pills. Many of your patients will say, my nephew stays abroad. He brought me this big jar of pills. Research has shown that when you give pills in the artificial form, the effect is not as good as if you take it in the natural form. So again, the message, stay within your weight zone and eat a good, healthy diet, vitamin A, C, and E. Apart from your fruits, veggies, fish, for example, is very good in these antioxidants. Green tea is very good. It has an active compound called ECGC. Haldi or curcumin, which is kachi haldi, supposedly very, very good in laboratory. Again, healthy diet. So I just have a lot of beet, apples, carrots, that kind of diet, all chemo preventive.
Dr. D'Cruz, since you said you specialize in head and neck cancer, what are some of the common symptoms that people must keep in mind or keep a lookout for to be able to detect the early signs of cancer? And how does early detection impact the prognosis of the disease?
So very simple. Cancer is of 4 stages. Stage 1, when it's confined to the organ. Stage 2, when it goes to the lymph glands, the draining lymph glands. Stage 3, when it goes to surrounding structures. And stage 4, when it's spread. Now, there's variations in this, but I've just generalized this very, very simply. You don't have to be a rocket scientist to know this. If you are in stage 1, we cure 90 to 95% of our patients. Less functional, less cosmetic problems. We usually treat with single modality therapy. We don't need a combination of surgery, radio, chemo. The larger the cancer, the more treatment, costlier, Functional cosmetic problems are more, success rate is less. So early diagnosis is very, very important. Now you ask me specifically about head and neck. Head and neck has like 14 subsites, like you can have cheek, you can have tongue, you can have jaw, you can have throat, you can have tonsil. All these are called cancers of the upper aerodigestive tract, usually tobacco related in 90%, tobacco and alcohol, 90%. 10% of people, other causes, some of them unknown. In addition, thyroid and parotid salivary glands are also head and neck cancers and come under the realm of the head and neck cancer. So in all these, if you come in an early stage, we can treat very simply. Now I'll give you an example of thyroid. You are young, you come in an early stage, we can only take out half the thyroid instead of the entire thyroid. Safe, 95 to 99% will live more than 25, 30, 40 years. You come with advanced stage that's eaten into your nerves. We have to take out the whole thyroid. We have to give you radioiodine. We have to give you external radiotherapy. Lot of problems. How do they know they've got an early cancer? If it's in the mouth, there'll usually be a color change. Our mouth is pink. The moment you get white and red patches, particularly if you're a tobacco user, go see your doctor. You can have a growth, you can have an ulcer. It can be on the tongue, it can be on the cheek. If it's on the jaw, sometimes you have loosening of your teeth for no unknown reason. It's a cancer smoldering next to the jaw. More so in tobacco. Go back, if it's in your throat, when you swallow, you'll get pain or you'll feel a foreign body sensation. If it's in the voice box, you'll have a change in the voice. If you've been a little careless and you've allowed the cancer to grow, it will come into the lymph gland. So when you feel, you'll feel like a lymph gland, a small pea or a small lime in your neck. Go see your doctor. Of people more than 40 years of age with a lymph gland, 80% of them are cancerous.
And Dr. D'Cruz, this actually brings a thought in my mind that when it is something related to your mouth or an oral cancer or what you're saying in terms of color change inside your mouth, would it be correct to assume that most likely the patient is going to go to a dentist or someone related to that? What could be the role of a dentist to be able to identify or help a patient identify cancer at an early stage?
You see, Harminder, oral cancer is India's cancer. We just choose so much of tobacco in this country. About a third of our population chew it. And I'm just taking the liberty to say this on your channel. You watch IPL cricket, every second, third ad is some various forms of elaichi, which are really a surrogate for tobacco. And it's being advertised by some of the biggest names in our country who have a tremendous impact on kids. So there's something that we really need to do to stop this menace of getting people to take these habits and get prone to cancer. It's very, very important. So I've just taken the liberty to digress and kind of give this important message.
Absolutely, sir. So what is the role of a dentist? What do you recommend to a dentist?
Apologies. So the dentist, I won't say the dentist, I would say any doctor. So oral cancer is a very, very common cancer within our country. Any doctor usually says, Jaban dikhao, put your tongue out, and they put the torch in and then they look at the rest of their body. Dentists and any doctor would be very, very helpful to pick up these pre-cancerous lesions before they become cancer and are just a color change, where if we cure, we have 100% cure rate with minimal surgery or sometimes even just stopping the habit. There's something called high-risk pre-malignant lesions, and we are just able to stop the habit and prevent. So dentists, yes, have a very, very important role. You know, when we were kids, they used to say, if you were the prime minister for a day, or if you were the health minister for a day, what would you do? If I was the health minister or prime minister for a day for oral cancer, I will make every dental college in this country adopt one district and just do simple looking into the mouth of people when they come for other ailments. We have randomized evidence from this country in the southern state of Kerala, about 100,000 patients in two groups. One group had just the mouth seen every 3 years by a health worker and health education. The other group only had health education. The group that had a health worker that was just trained for a month and they've started going out, we could save lives in that group by looking into the mouth of population once every 3 years. You don't have to get the patient into the hospital every day, once every 3 years. Now you have a dental college that's adopted a district, just break it up, see people's mouth, do dental care, pick up oral cancers. We'll be so much happier as head and neck surgeons.
I think it is imperative, that every dentist, as a part of their role to contribute towards fighting oral cancer, make it a point to screen the patient when they open the patient's mouth diligently, cautiously, to look for this and report it. If
So the one important point, since you asked me specifically for dentists, very often dentists see a growth and they pull out the teeth. I would tell any dentist who is watching your show, please don't do that. Because when you remove a tooth and you've got cancer in and around that area, you're opening a tooth socket. The cancer will grow into the socket. Whatever chance I had of saving someone's jawbone, now I have to remove the jawbone. So a message, if it's going to be viewed by dentists and even for people, that don't unnecessarily remove your tooth. If you have a growth there, even if your dentist tells you to remove, go take a second opinion.
Fantastic. I think this is extremely important. And Dr. D'Cruz, since you mentioned screening, what do you think are the disparities of access of screening, diagnosis of oral cancer? Because if you're looking at chewing of tobacco, it is not just an urban population. It is into the interiors.
Of
But
course,
do we have access to diagnosis and screening facilities in these areas?
So let me tell you very, very quickly again. Abroad, they screen for many cancers. We really do not have compelling evidence that you need to invest a lot of money and screening is going to save lives. It does help in certain cancers. You can't go and screen everybody for a pancreatic cancer doing tumor markers. So many people go for these health checkups and they do a whole lot of tumor markers, CA19-9, CEA for colon, CA125 for breast, no, for ovary. Then they do something for the breast. Firstly, don't do tumor markers. They don't screen and they don't help you. In fact, they'll cause false positives. You'll get panicky. You'll be pushed into other. Yes, it does help in certain cancers. Like I told you, oral cancer. There is some evidence that in postmenopausal breast ladies, there's very compelling evidence cervical cancer in women if you do a pap smear or an HPV DNA. So in certain cancers, yes, you do that. But more importantly, I think people should understand what the warning signs of cancers are. And it's very simple. I'm not going to spend time on the show telling people what the warning signs are. It's very nice. A lot of groups, overseas cancer control organizations, it goes by a very simple acronym called CAUTION, CAUTION. Like change in any swelling that you have in your body, or an abnormal discharge from any part of your body. If you just go through that, and it's a free download on the net. So I just tell people to price caution, warning signs, know the warning signs. But basically, quickly to say, bleeding from any orifice of your body which is not normal, Like say, even for a lady, intermenstrual bleeding, postcoital bleeding, postmenopausal bleeding, you bleed from one side of your nose, you pass urine in your blood, you pass urine in your stool, all these cause, or you cough and you bring out blood, all of these warning sign of cancer. You have a new lump on your body, go show your doctor. You have any symptom that is not, like even sometimes you might just start feeling tired. You were a healthy guy and then suddenly you start feeling tired at the end of the day, that persists, low grade fever, change in bowel habits, distension of the abdomen, go see your doctor. These are all warning signs. You'll come in and stage 1, 90% cure it.
Dr. D'Cruz, what a meaningful conversation this has been. Because what you've done is you've broken down all the technical stuff and made it understandable for the layman. So thank you so much for your time. And,
Pleasure.
some of the takeaways for me, for the audience is that, for you to stay healthy, you have to take care of yourself physically and mentally. And specifically for our country, where you have so much of access to unhealthy stuff like supari, tobacco, everyone has to make a conscious effort to stop themselves from consuming it and stop people around themselves to consume it, so that we could have a healthier population in this country. And food and nutrition part of it, because normally when we are talking of cancer, we forget this aspect because we have focused more on the treatment, prognosis, etc. I think the ACE, as you gave us, is really, really important. And, vitamin A, C, E. And you also gave us a way to identify the bright fruits are the ones that usually will have, vitamin A, C, E. Thank you so much.
Thank you, Arvinder. A pleasure. We can do something to impact the lives of people. God bless you for the wonderful work you do and take it to people as well.
Thank you.
So I always say together we can make a meaningful impact.
Absolutely.
We can touch people's lives, and you continue your mission. We continue our mission, and wish everybody who's watching this a very nice, healthy, prosperous, and disease-free life. As Kushwant Singh always said, rule number 1, you must have a healthy life. If you have as much money as you have and you don't have a healthy life, what's the use of all that money? And I tell this to all my patients. Of course, Kushwant Singh, we all know him. He was very, very humorous and very witty, and he had many, many other rules to his life. Some naughty and some not so naughty, but I just like the rule 1.
Absolutely. I think that's very important, and we should get inspiration from him. He was playing tennis till very fag end of his life.
Absolutely.
So I think, people like him can be an inspiration to everyone around.